here we are again today with Dr. Olsen. Welcome, Dr. Olsen.
Thanks. It's good to be here today, Denise.
And our subject today, we had spoke before about headaches, but today we're going to talk specifically about headaches and the spine. And there's a whole industry that is devoted to headaches, and yet we have our expert here, Dr. Olsen, to talk about alternative ways of dealing with headaches, and specifically today, headaches of the spine.
Excellent. Yes, thank you, Denise. Today we are going to talk about headaches and how they can come from the spine. Many times we look at people experience headaches and may think that it's entirely coming from around the head, not realizing that many times this area in the neck is the area where it's coming from. So there can be different causes with that. In the neck we have a group of muscles, we've got ligaments, we've got tendons, we've got the spinal joints. Each one of those tissues and areas can be associated with a source of pain that can cause headaches and refer pain up to the head and neck area. Okay, so I brought a little model here, and this is a way of showing some of how it works. With the spine, these are the spinal joints in this area. When we have a problem with alignment in the spine, or the spine's not moving properly, we can get irritation to the spine. And so in this area here, this clear area would be an area where it's working normally. Okay, this area would be an area that's inflamed, that's red. Okay, and this area would be an area where it's been inflamed for a period of time and scar tissue has begun to form. Okay, but what happens is when you have the spine and it's not moving correctly, okay, the muscles that are attaching into the spine can then become irritated. These joints are giving feedback to those muscles, and so when they're moving improperly, they give improper feedback to the muscles. The muscles then start to tighten and spasm. That leads to a situation called myofascial pain and dysfunction. It's basically where the muscles get knots and small knots in them. Those knots produce pain, and those one characteristic of them is they refer pain. And in the neck, they commonly refer pain. Yes, it can be the base of the skull, top of the skull, front of the skull here. So the great majority of the time when people or patients come in and they're experiencing headaches, obviously we look for head areas if there's problems with that, but I'd say a big majority of the time we are looking at problems related to the structure of the neck, muscles, ligaments, tendons, or those joints in the spine.
Fascinating. So it sounds much more complicated than just taking an aspirin. So let's say someone was interested in finding out more about headaches and how they initiate from the spine. How would they go about coming to see you, Dr. Olsen?
Well, the best thing that you can do is contact the office. We can get you scheduled for a consultation. The phone number at the office is 949-859-5192. The second option is you can visit our website, AskDrOlsen.com. That's a great place for information. You can see more about these details, how we approach headaches and chronic problems, and without any drugs or surgery.
Well, it sounds great if someone wants something alternative. And there's, I'm sure, information on you and your practice and how long you've been practicing as well on the website?
Oh, definitely. It's got a great deal of information in there. Get information about myself, about the practice, about how we approach these types of problems. And some great success stories on there, so you can see what other people have experienced in their treatment with the office.
Great. Thank you so much, Dr. Olsen, and hopefully you've learned a little something. And for more information, again, you can go to AskDrOlsen.com. Have a great day.